Heart health is vital, with 1 in every 4 deaths in the United States being a result of a heart disease. Dr. Subda Devabhaktuni is a cardiologist and electrophysiologist who tells us this episode when you need to talk to your doctor. He specializes in heart rhythm problems at UAMS. This is UAMS Health Talk, the podcast from the University of Arkansas for Medical Sciences. I'm Caitlin White. Doctor, to start off, what are the most common heart diseases you deal with in your practice?
So the question, what I would say is I'm an electrophysiologist by training, and that's what I do. So being electrophysiologist means I deal with the heart rhythm problems. The most common rhythm problem I see is atrial fibrillation, which is an irregular heart rhythm that's very prevalent in patients of age group 60 or above. It's a very common problem we see. The main problem with that is the stroke risk, and we put them on blood thinners if they meet certain criteria to prevent a stroke. That's one rhythm problem I see commonly. And the other heart rhythm problem I see is abnormal heart rhythms coming from the top chambers in the heart and the bottom chambers in the heart. These are all the common rhythm problems I see. In addition to that, being a cardiologist, before being electrophysiologist, I see problems like patients with blockages in the heart blood vessels or like any leaky valves or tight valves like that. These are the problems we see. And other problem we see is patients with passing out. We call it as syncope or lightheadedness. And some patients complain of palpitations, which is racing in the heart. These, again, the syncope and palpitations could be related to heart rhythm problems, or it can be related to abnormal heart structure, like heart function being low. That can lead to people having dizziness or passing out from abnormal heart rhythm problems. And also the heart doesn't pump well, so they have dizziness, shortness of breath, and swelling in the legs.
Now, what advice do you find yourself giving most often to your patients?
The advice, I would say, eat healthy food, watch what you're eating, and then try to exercise at least 30 to 45 minutes, 3 to 4 times in a week. I try to practice this myself prior to advocating to the patients, because I need to take care of myself before I tell the patients what to do and what not to do. And other important things are, if they need medications, take the medications regularly, and I would say keep up appointments with the doctors.
Now, can you describe the cardiovascular team at UAMS Health and all the different subspecialties within the practice?
We have a great team at UAMS Cardiology. That our division is growing rapidly to provide the state-of-art care in the state, Arkansas. We have a general cardiologist who deal with problems like coronary artery disease, which is blockages in the heart, or hypertension, and also other problems like leaky valves or a tight valve. We have my colleagues who specialize in this valvular heart problems, either to see how bad the valve problem is. We do echocardiograms, which is an ultrasound of the heart, and also some other modalities like CT scan to have a better look, and also a heart MRI to have a better look at what the problem is. So these are the common problems we see. And then myself and I have 2 other colleagues who take care of heart rhythm problems. We take care of pretty much any heart rhythm problem, be it a common rhythm problem, a simple one, which is a flutter, which goes in the top right atrial chamber, or it can be very complex problems like AFib, the one we discussed before, the irregular heart rhythm, and also sometimes you can have dangerous heart rhythms coming from the bottom chamber in the heart. That also we deal with a procedure called ablation. It's a minimally invasive procedure. We do it under moderate sedation or general anesthesia, depending on the complexity. We put catheters inside the heart, going up the veins from the groin into the heart. We don't crack open the chest. It's a minimally invasive procedure to take care of these heart rhythm problems. In addition to that, we recently fortunate enough to recruit another faculty member who deals with, it's called structural heart disease, like these valves and the patients are not a candidate for surgery or they are high risk for surgical operations, they would go for these procedures where they can replace a valve with these minimally invasive procedures. And also in patients who have problems with bleeding when they're on blood thinners, there are certain type of devices where we can put inside the heart where these clots form so that the clots do not go into the circulation and cause stroke. These devices, we do them. And also the pacemakers and defibrillators in patients who need them, we do those. And I also do, there's a new technology called physiologic pacing, which is pacing the normal conduction system of the heart, which has been around from 70s, but it came into limelight in the last 6-7 years. We are doing that too at UMS. And pretty much by the end of the year, we'll have advanced heart care like patients with artificial hearts and heart transplants will be starting to do them soon. We have surgeon Dr. Jay Bama who will be spearheading that advanced heart care program.
Wonderful. Well, Doctor, is there anything else you'd like to share about your department or your team at UAMS Health?
Yeah, as a member of UMS Cardiology Department, I would say that we will probably be one of the best centers in future. And we currently, as we discussed before, we offer all the treatment modalities for all the cardiac problems. And we are an excellent team. We work with each other very closely. If anyone has any problems related to the heart, we would be happy to see them in our clinic, and we would be taking care of them very quickly in an efficient way.
Great. Well, Doctor, thank you so much for joining us today and for sharing this information. If you're looking for even more information, visit uamshealth.com. And thank you for listening today. This has been UAMS Health Talk, the podcast from the University of Arkansas for Medical Sciences. I'm Caitlin White. Stay well.